If you already have VA benefits, do you really need Medicare too? In this video, I'm going to walk you through 5 reasons to enroll in Medicare, even if you already have VA coverage. We'll talk coordination, costs, coverage gaps, and what other veterans wish they'd known before skipping out on Medicare. And stick around to the end and I'll share a bonus tip on how to reduce your Medicare premium based on specialized plans designed for your veteran. Hello, my name is Edwin John Rodriguez, your licensed health insurance representative. On this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients understand, care, and enroll plans based on their needs and goals. Now let's get into it. Here are 5 reasons to enroll into Medicare, even if you already have VA benefits. Reason number 1 is VA coverage is not guaranteed everywhere. Here's the thing, most people don't realize about VA benefits. They're location specific. Your care is tied to VA facilities, and if you move or travel, even if it's for a short period, you can be stuck with limited access or delayed care. Now, let's say you're visiting family in another state and you need to see a doctor urgently. If there's no nearby VA hospital, your options may become very limited unless you also have Medicare. Now, compare that to original Medicare. With Medicare Part A and Part B, you can actually go to any provider that accepts Medicare. That's over 90% of hospitals and doctors nationally. No referrals, no VA-only restrictions, no waiting to be approved for outside care. This kind of flexibility is huge, especially for retirees who regularly travel or anyone who just wants a peace of mind knowing that they're covered wherever life takes them. Reason number 2 is for emergencies outside of the VA network. If you rely on VA benefits alone, getting emergency care outside of a VA facility can be complicated and sometimes also risky. Now, here's the catch. The VA does not pay for emergency services at a non-VA hospital unless very specific conditions are met. And that includes notifying them within 72 hours, providing that there is no other VA facility available, and showing that that care was actually a true emergency. And even then, it's not guaranteed to be covered. That's where Medicare comes in. Medicare Parts A and B cover emergency care at any Medicare-approved hospital or urgent care facility nationwide. No red tape, no special approvals. You get the care you need and where you need it. Reason number 3 is going to be to avoid late enrollment penalties. Here's something that a lot of veterans don't know. If you skip enrolling into Medicare when you first are eligible, usually at age 65, you could face lifetime penalties down the road, even if you have VA benefits. The government doesn't consider them credible coverage for your Part B. That means if you delay enrolling into Medicare without other qualifying coverage, like employer-sponsored insurance, you'll likely pay a penalty for every year you've waited after turning 65. And those penalties, they never go away. They're actually lifetime penalties. The penalty is 10% for every 12 months you delay your Medicare Part B from your coverage. And this is added to your Medicare Part B premium for life. I've worked with veterans who've had to pay an extra $40 to $70 a month every month just because no one explained this to them when they turned 65. And the worst part is many of them didn't even plan to use Medicare right away. But enrolling on time would have protected their future options and helped them avoid permanent penalties. Even if you plan to rely on VA care most of the time, enrolling into Medicare gives you added flexibility and helps you steer clear of any surprise costs later on. Reason number 4 you may want is for more flexibility with healthcare providers. The VA is a great system for many, but it also means you're largely limited to VA doctors, VA clinics, and VA hospitals. And if you want to see specialists outside of the VA, you often need referrals and approvals and authorizations from the VA to be able to do so. With Medicare, specifically original Medicare, Parts A and B, you can see any doctor or specialist that accepts Medicare, which the vast majority of providers nationwide do. Now, keep in mind, Medicare isn't free. There are costs associated with seeking medical care when on straight Medicare. So we have another video right here that explains Medicare costs, but Medicare is more important if you want to choose your own provider. You can see a non-VA doctor regularly, especially if you split your time between other states or travel often, or if you just want a second opinion from a civilian doctor. You might be perfectly happy with the VA benefits, but life changes. Your health can change, your coverage needs might change. And when it does, Medicare gives you the flexibility to expand on the care that you may later need and or want. Reason number 5 is going to be drug coverage gaps. If you're using the VA for your medications, you probably already know. Yes, the VA offers low-cost prescriptions, but only certain medications. And here's the fine print that most people miss. If a non-VA doctor prescribes a medication during a hospital visit, an ER trip, or a private specialist, the VA may not fill it. You often have to go back to a VA provider just to re-verify and re-prescribe the same medication through their system. And even then, some prescriptions are excluded or not stocked in certain VA pharmacies. Medicare can help reduce this risk. And when you enroll in a Medicare, you can also get a Part D drug plan, either a standalone drug plan or one that's bundled into a Medicare Advantage plan. This means you can fill your prescriptions at a local pharmacy. No more waiting, no more needing to coordinate between VA or non-VA doctors, just simpler access to the meds when you need them. And as promised, here's your bonus tip for today. In most states, you can find Medicare Advantage plans that will help you pay for some or most of your Medicare premiums. These are called Part B givebacks. These plans are sometimes designed specifically for VA recipients. And these plans offer all the same benefits as original Medicare, but through a private insurance company. These plans can generally include additional benefits that traditional Medicare normally doesn't cover, like dental, vision, hearing, a gym membership, and in some cases, pharmacy benefits as well. It's important to understand all of your options when it comes time to enroll in Medicare, even if you already have VA benefits. So now you know, having VA benefits doesn't mean you should skip Medicare. In fact, you should at least take a look to see what your options are in your area. You may be surprised to see what you find out. If you found this video helpful, go ahead and give it a like. It will help other folks just like you find this information. Make sure to hit the subscribe button so you don't miss out future videos. Insurance rules are always changing. And if you're subscribed, we'll make sure we keep you up to date and informed as new information comes out. And if you're still weighing your options or want some expert guidance, you can schedule a call using the link below. We'll be honored to help you out. No pressure, no sales pitch, just clarity. And again, doing so supports the channel in the process. If you got value from this video, consider watching this video here. Until then, take care and thank you for your service.